Good morning, I'm Dr. Kerry Chant from New South Wales Health with the COVID update for Friday the 24th of December. Across New South Wales we've got 94.9% of people aged 16 and over have received a first dose of a COVID vaccine and 93.5% have received 2 doses. Of people aged 12 to 15-year-olds, 81.6% have received their first dose and 78.3% have received 2 doses. We currently have 382 COVID-19 cases admitted to hospital, with 53 people in intensive care, 12 of whom require ventilation. And there were 5,612 cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and that was out of more than 160,000 tests reported during that period. So a big thank you to all of those testing clinics and those pathology services that are doing their best to get those tests processed as quickly as possible. A reminder to everyone about the need to get vaccinated now. If you've not yet had your first dose, get it. If you've not yet had your second dose and it's due, come forward for that promptly. We continue to see that most of the people admitted to our ICUs are unvaccinated. Thank you to everyone who's come forward to receive your booster dose. Our program in New South Wales Health continues to ramp up, and it's complemented by that activity in pharmacies and general practice. We've already delivered about 130,000 vaccine booster doses to help keep the community safe. The booster dose is essential in upping our level of protection, particularly against the Omicron variant. So please get your booster dose when it's due. Boosters are important, particularly if you're elderly or have underlying health conditions, but everyone should come forward for a booster when they're due. Bookings are now also open for children 5 years and over. That will commence on the 10th of January, but go online now and book your space. And we know that general practitioners and pharmacies will also be offering vaccines in the new year as well. There were a range of measures that were implemented, and it's important to know that masks are now compulsory in all indoor, non-residential settings, including for hospitality staff and in offices, unless you're eating or drinking. From Monday the 27th of December 2021, QR code check-ins will become compulsory. Hospitality venues, including pubs, clubs, restaurants and cafes, will move to 1 person per 2 square metre rules indoors. There'll be no density limits for outdoor settings, as we really encourage people to use outdoor settings and preference those environments as they're much more safe from a COVID perspective. All of these settings will remain in place till Thursday the 27th of January 2022. New South Wales Health reminds people that when you receive that notification from the QR code check-in, that just lets you know that someone was in that vicinity or in that premise who's subsequently tested COVID positive. What we're stressing is that that's a prompt, a reminder for you to monitor for symptoms. So please get tested if you're unwell, but don't get tested unless you are feeling unwell. It is important that we keep those testing resources focused on people that have symptoms or people that we've directed from public health to get tested, or where you know that you've had close contact with a case, either be that through your social or workplace contacts. So I'd like to thank the community for their incredible response in coming out for testing as transmission rates of COVID have increased across the state. Please get tested if you've got symptoms, even if they're mild. And as I said, also get tested if you've been in contact with someone who's got COVID, particularly in an indoor environment. Around a quarter of people exposed to COVID may still develop their infection after the 7 days. So the majority develop infections within the first 7 days after you've been exposed to a case, but you can develop those symptoms for the next 7 days. So close contacts should exercise caution, consider their movements in that next 7 days and make those decisions. Please please, I know this is a time of year where we're reconnecting with our friends and family, but please stay home and avoid those events if you have the mildest of symptoms. Please instead get tested and isolate. Your family and friends will be very understanding of your actions in not attending, and that's the safest course of action. Also, we just want to let the community know that, as I said, as you're conducting these social functions, please choose those outdoor settings. Having elderly or vulnerable people sitting on verandas in outdoor settings, if the weather's fine, that will reduce their risk of transmission. Also, if you're going into indoor spaces, really look at the ventilation. Can you keep those doors and windows open? Even in churches and other buildings, we're encouraging everyone to look at how we can really improve the ventilation in those settings. Again, a risk mitigant. So as we learn to live with COVID, we're going to have to continue to practice these COVID-safe behaviours and modify our environments through, opening the windows, opening doors, choosing those well-ventilated spaces. So again, thank you for your coming forward for testing. Thank you for coming forward for vaccination. And thank you for caring for each other through mask wearing and the other actions you have taken as a community. We look forward to keeping you updated over the Christmas New Year period, and please stay COVID safe. Thank you.